TMJ4 News is committed to helping parents and students and educators make the best decisions possible about returning to school. All this week, we're going to be telling stories to get students safely back to school. Many concerns from parents come with virtual learning and the impact that has on students' mental health. Ryan Jenkins spoke with a child psychiatrist who shared advice on helping your family cope.
Whether your child is physically returning to the classroom in the weeks ahead or preparing to return to school virtually, the added pressure that your child might be feeling as they prepare to start a new school year amid the coronavirus pandemic cannot be ignored.
It's overwhelming. I think the majority feel like that.
Myra Delapaz is a mother of 3 and says her children are doing their best to adjust to the changes COVID-19 has forced upon them. But as they prepare to return to a virtual classroom this fall, she worries about the emotional impacts of too much social distancing.
Obviously, academics are important, but emotional and mental health are like my first priority.
Myra isn't alone.
It's something that we're thinking about, but we don't have the answers to it all.
Father of 2 Isaiah Weatherall has the same concerns as he tries to keep his 14-year-old and his 3-year-old safe from the spreading virus, cutting the kids off from their normal social interactions.
Me and my wife are constantly looking and trying to figure out what else we can do to kind of supplement what's being lost.
I turned to Dr. Himanshu Agrawal, an assistant professor of psychiatry and behavioral medicine at the Medical College of Wisconsin, to ask what can parents do to check in on their children.
Take every opportunity to check in with them, either verbally or non-verbally.
Dr. Agrawal says back to school season is one of the most stressful times for kids, and this year with COVID-19's disruptions, there needs to be an increased awareness of red flags that signal depression and anxiety in children.
If the child has stopped enjoying things that they usually like doing, or if the child is isolating too much in their room, or is more irritable than usual, or is sleeping too little or too much, or is eating too little or too much, those might be some red flags to look out for.
He also says to ask your child directly about their feelings and to keep an ear open for unexplainable physical complaints. And remember, nonverbal reactions to everything happening in the world can also have an impact on their mental health.
How we are reacting to distressing news, they're noticing everything.
As social distancing keeps kids from their friends, Dr. Agrawal suggests getting innovative. Schedule safe, spontaneous play dates. He said physical isolation doesn't equal social isolation.
It becomes even more important now than ever to take extra measures to mitigate social isolation.
So here's your rebound rundown. For kids struggling with social isolation, schedule safe play dates and be direct when asking them about their feelings. If you notice signs of depression in your child, contact your primary care doctor. In Milwaukee, Ryan Jenkins, TMJ4 News.
And for all of our safely back to school stories we're going to bring you this week, you can head to tmj4.com/rebound and look for the Keeping You Safe tab.